Hi, I'm Robin, and I came to see Dr. Kessler for CO2 Laser. Back in September, I was diagnosed with melanoma. It was on my leg, and I, over the years, have had a lot of sun damage. When I was younger, I was a lifeguard and a swim instructor. That was my first job, and I grew up with a pool in the backyard. And then over the years, I've always had a swimming pool, and I'm a big time swimmer. I used to do triathlons, so I competed a lot outdoors. So I've damaged a lot of my skin. And I was not good about sunscreen. I grew up in the 80s, and I think it was everybody, we were like putting butter and Bain de Soleil and all this like horrible stuff on our skin to try to get a darker tan. And I spent a lot of time here in Corona del Mar at the beach. In fact, I did it, one of my triathlons was here in Newport Beach. But with the melanoma diagnosis, I thought, oh my gosh, I want to get off any kind of precancerous growths that I can. And also achieve the benefit of rejuvenating my skin. And so I did research online thinking, well, what was going to be the best option for me? And I chose CO2 laser because that was the only procedure where I could be sedated and not feel pain. And, you know, I thought, well, I mean, and it also is probably the most effective as far as, at least what I could tell, I don't know. So I talked to Dr. Kessler about that, and he explained the procedure to me. Told me I'd need about, 5 days or a week off of work. So I scheduled it, and, I had to come in and do the COVID tests beforehand. Because this was just literally like a couple months ago that I had this. For 5 days I couldn't leave the house because my face was just oozing and yucky. And I think the hardest part about the procedure was the product you have to put on afterwards. So it's like this, almost like it's called laser balm, but to me it's like a petroleum jelly kind of base type thing, that kind of consistency. And so my face, it was just like, it just bothered me, But I was faithful about putting that on all the time because I knew that I needed to, because Dr. Kessler explained the importance of that. My skin, within like a week, I was back at work. I mean, I was amazed. I thought there is no way that I'm going to be able to go back to work. My skin is horrible. I mean, it was red, it was oozing. It didn't hurt much. It hurt a little bit the first couple of days, but not anything severe, nothing that I couldn't tolerate. So I was surprised that after a week, just like Dr. Kessler said, I was able to go back to work. And so now, I don't apply nearly as much makeup as I used to, but I do apply a lot of sunscreen. Very happy with my results, yes. That's probably why my stepdaughter said, "You look like you're just getting younger." I didn't tell her why. No, but I think between the BioT hormones and the CO2 laser has helped my skin overall because I have more moisture in my skin. And then by taking off a lot of sun damage and then, stimulating collagen growth, I know my skin's just going to continue to improve.